Good morning, good afternoon, good evening, everybody. Welcome to the webinar on impact evaluation, strategic directions, challenges, and innovations. We're just waiting a couple of minutes for other participants to join in. Currently, there are 65 and coming. Thank you for your patience. Zlata, I think we're good. Over to you.
Thank you, Celeste, and hello everyone, and very warm welcome to this evaluation practice exchange seminar of UNET Group. And I'm Zlata Brukov, Senior Evaluation Specialist, Evaluation Office, Headquarters UNICEF. And I will be co-host with my counterpart, my colleague, Jonas Herman, who leads the Impact Evaluation Unit at our Office of Evaluation, WFP. We also will be joined later, about in half an hour, by our guest from GIZ, our senior social protection advisor, Stefan Bier, who we hope will give his perspective from the programmatic side on this topic. The reason we chose or proposed this topic for EPE session is basically we see that there is a lot of interest and demand from externally and internally to do more of rigorous evaluative evidence on impact and outcomes from donors, from our partners, from executive boards. But generally, this is an area which is still underdeveloped among UN agencies. The field of impact evaluation has grown exponentially in the last decade, and you know all probably about the Nobel Prizes that were given to social experiments and natural experiments in the recent years. But again, this is relatively underdeveloped area of evaluation for UN agencies. At the same time, we see that there are some changing shifts in our environment and challenges that will shape our work and shape the trends, basically. Big data, climate change acceleration, and increasing focus on humanitarian and development nexus. And we all are trying to grasp with all these different contextual factors. So therefore, we do need to help each other to exchange our practices on this and kind of build on the learning of each other and build the community of practice in this area of work among the UN agencies. That was our reasoning and that was our idea. But now, without further ado, I would like to invite Jonas to share with us what the WFP is doing in this area. Over to you, Jonas.
Okay, great. Thank you, Zlata, and thank you so much, everyone, for joining us today. Over the next 15, 20 minutes or so, I'm just going to give an overview of the journey that we've started here at WFP, kind of what we're trying to achieve and what we've learned, and some of the innovations that we're trying to try out going forward. I'm not sure, do I have control over the...
You have to say next slide, please.
Oh, okay, next. Thanks. I was clicking a button and it didn't do anything.
Celeste will, oh, sorry.
Zlata, it's you who has control.
That was change in plans. Let me do this. Huh.
No?
No, it's not moving. Oh, sorry.
Okay.
Can you see the next slide?
Yeah, I see it now.
Key takeaways, yes. Thank you.
Okay. So before I go into the content, I just want to actually start off with a few messages that I think resonate, particularly with evaluation offices and evaluation communities. For WFP, we see impact evaluation very much as a tool that's designed to support learning, and it does that by testing out program theories and understanding what works. It's definitely something that we see as having high internal validity and limited external. So we see evidence coming from impact evaluations as something that needs to be built up over time and across contexts and different programs. We also think that the important part of impact evaluation is that it's giving us a real glimpse at what is, in terms of programming, operationally working and effective. So to have that, you really need a strong level and a strong partnership built on trust with the program teams, but also with the donors that you're working with. It cannot be imposed. And then we also see that to make impact evaluation, I guess, happen in any context, M&E is still a crucial part. So program M&E is a critical kind of basic requirement to do good impact evaluation work. And then finally, impact evaluations are definitely for WFP something that complement other types of evaluations. We don't see them as replacing or in any form of hierarchy against other types of evidence, but they're one form that complements a wider evidence base about WFP programs. Next.
Sorry.
So in the next few minutes, I'm going to go briefly over the impact evaluation strategy at WFP and how that has then informed the later policy. I'm going to describe a bit about how we develop multi-country impact evaluation windows in key priority areas. And then I'm going to reflect a bit on some of the lessons learned over the last 5 years and some of the innovations that we're trying now. Next. So before, next, please. So before WFP actually embedded impact evaluation into its evaluation policy, we had an impact evaluation strategy that we launched in 2019. The strategy came after about a year of consultation with WFP's donors and program teams and other external experts. And it really was focusing on two main areas. One is that WFP sees impact evaluation as a tool for really optimizing interventions, so program learning. And two, it should do so in a way that the evidence generated provides thought leadership globally to the areas where WFP is operating. So it's not something that we see as only meeting internal needs, but something that we always reflect on, is this credible to an external academic and donor audience? Next. After 2 years of piloting that impact evaluation strategy, and in that period developing this portfolio that I'm going to talk about, impact evaluation was then finally embedded into WFP's corporate evaluation policy last year. This was based on recognition of the demand and the amount of attention and support that was going into impact evaluation, and also the kind of unique characteristics which made it very difficult for country offices to manage on their own, which is why we see decentralized evaluations. And it's also required significant specialist skills that were not already available in the Office of Evaluation, which is in the centralized evaluations. So to put in place this as a key or a third type of evaluation, we defined it quite narrowly. We described it or defined it as the evaluations that measure changes in development outcomes of interest that can be attributed to a specific program or policy through a credible counterfactual. So those are very loaded words for evaluation audiences. Obviously, we're looking at changes in development outcomes. So immediately, we're not using a kind of results framework definition of the word impact or OECD definition of the word impact. It's really about effectiveness. We're also looking for attribution. So it's very much thinking about a causal design. And for us, that causal design needs to have a credible counterfactual. And so that's pointing us towards a limited set of methods, but we're complementing it as we go forward. The other reason for kind of narrowing it down a bit was it was not seen as something that needed to be needed to replace already existing work. So for decentralized evaluations in WFP, they do a lot of different mixed methods and qualitative evaluation work. For centralized evaluations, there's a very standardized kind of performance based and process evaluation. And those two things are continuing. And then why do we do impact evaluations? Is because it does something additional or different that was not already there. The other thing is that impact evaluations in this way are seen as taking place very much during program implementation. This helps us to make sure that we have the quality data that we need before programs start implementing. So it's really putting in place baselines and then tracking progress over time. And they're not officially or required to be presented to our executive board. And this is distinguishing them from centralized evaluations, which do have to be reported to the board. The reason for that, again, is because it's seen as a learning tool, and we see it as something that needs to build up over time. And that we haven't decided to have no coverage norm. So there's never a requirement for any WFP office to do an impact evaluation. Next. So in that context, the strategy, which is trying to focus on demand-led impact evaluation, kind of has four overarching objectives. One is that, again, contributing to global goals, delivered operational, but to make sure that it does meet demand, we had to maximize the responsiveness. So the unit that we have in HQ really is just there to make sure that we're responding to country office contexts and needs as we identify them, and then seeing if they can fit into this definition of WFP's impact evaluation. And it's also focused on, to the extent possible, harnessing new technologies and data sources. Next. Early on, when we started off on this work, we did not have an impact evaluation unit. That came, again, last year after it was made as part of the WFP policy. And so we really relied on technical partnerships. For WFP, the first strong, big technical partnership that we had was with the World Bank's DIME department, their department now. And that was kind of chosen for two reasons. One, DIME had a long track record of doing impact evaluations in the development space. And two, WFP and the World Bank had a global strategy that they signed in 2018, which is the year before we launched our strategy for impact evaluation. They really set out a vision for working in this nexus space and tackling both humanitarian and development challenges together. And so DIME became a kind of an obvious choice for a partner at the beginning of this work at WFP. Next. In addition, all of the work that we do at WFP is supported with, amazing and great support from our donor community. So at the moment, that includes BMZ and KFW, COICA, USAID, and we're just discussing now with NORAD about working on homegrown school feeding together in Malawi. But they really make this possible. The cost of impact evaluations varies greatly, but it does tend to be higher than other types of evaluation, largely due to the time. They run over 3 or 4 years and the amount of primary data collected. We also work closely with other UN partners. So in Sudan and South Sudan, where we're working on impact evaluations that are funded by BMZ, there we're actually doing it of joint programs. And so those joint programs are also the impact evaluations are also developed jointly with the program teams from both sides to make sure that the questions we ask and the tools we use answer UNICEF and WFP priority questions. And then we work with a large range of external networks and academics. Next. No?
It doesn't vote for some reason.
Okay, I can. Well, the next ones would be the windows, I think.
Yeah.
Okay, so go for one further then. No? Okay. So in this context where we're trying to support demand-led impact evaluations and there's no coverage norm, we had to think a lot about why and when to use impact evaluation. And so we focused on organizing our impact evaluations around corporate priority areas for WFP. And to do that, we developed what we call impact evaluation windows. It's kind of a normal term in the impact evaluation space, also for other research, but we have a couple of kind of twists on how we do it. One is that these windows are developed very much in partnership with program divisions. So they are involved in identifying what they see as the strategic priorities for evidence. So looking forward, where do we see WFP spending more money and focusing more attention? We also then have no need in terms of shifting the windows to actually close them. What you see instead is that these windows would evolve over time by updating the priorities as and when WFP updates its policies or strategies. We would only think of closing a window if, for example, WFP were to stop doing cash transfers or stop focusing on one of the key priority areas. And these priority areas were selected. Again, they align with WFP's program divisions. Across the windows, we also have a humanitarian workstream, which is really about the context we operate in. So the humanitarian context still focus on the same outcomes. Like we still want to achieve climate adaptation and resilience objectives, but there's a different way of working and a different need for thinking about data sources and tools. So that work stream is across all of our windows. Next. So when we set out to develop a window, after we do, or in parallel actually with the consultation process, which is with WFP HQ and also country offices and regional bureaus, we also conduct a literature review. The literature review is very much focused in on the same areas where they see priority in terms of spending. And it looks at the last, in most cases, there's been the last 10 years of rigorous impact evaluation evidence for the type of interventions that are being supported. And that helps us then choose from a longer list of questions which intervention types or questions are not well supported with rigorous impact evaluation evidence. So that helps us then narrow down where we should focus our impact evaluations. We then put out a call for expressions of interest to all country offices, basically informing them of the priority area and the opportunity to work with us on impact evaluations. And they're being asked to volunteer their future programming. So they're being asked to think about in the next 6 months or the next year, will you be delivering new programs that would fit into these windows? And can we work with you on designing a rigorous impact evaluation of that program? We then conduct feasibility assessments of the programs that volunteer. And then finally, the country selection is again proposed back to a steering committee here in HQ that also includes program colleagues. And that's just to confirm that the country selection is also, again, relevant to the operational questions and priorities here at WFP. Next. An example of one of these impact evaluations that we have ongoing right now, and this is a design that's actually being rolled out in 3 countries, so El Salvador, Rwanda, and Kenya. And early on, I mean, the first window that we opened was on cash and gender, and we did the literature review. And literature review showed that cash does have positive or potential positive impacts on women through different mechanisms, but it doesn't tend to give them directly more authority or more decision-making power. We also saw studies and also qualitative work done by WFP that said that women have more control when the income that they have is seen as earned income or income assigned because they were contributing some amount of time for that income. And so for WFP, food assistance for assets is a very common programming approach. It's a way of basically helping communities develop assets that will have longer term benefits. But during the process, it actually requires communities to assign people to work on those assets. And those can be both community level and actually household level. And so in a lot of cases, there's no clear gender designation, but men tend to be the ones who are assigned to work. So we actually created the opportunity by just saying in a handful of communities in each country, we will offer an option, which is a women's only focused food assistance for assets programming. And then households can choose to participate by volunteering women can choose to participate by volunteering their own time to work on those assets. And so then what we're trying to understand is, compared to groups that are doing food assistance as business as usual, does offering women the explicit option and giving a women a safe space to work, does that change the control over women's income, but also their decision-making power and then perceptions of women's work, in addition to all the normal outcomes that we're looking at in terms of consumption and earnings and time use? Next. That was just an example. As you can see, across the 3 windows that we already have open, the 4th one on nutrition is going to be open in 2023. We have 15 kind of confirmed and about 18 ongoing impact evaluations. They all have some form of experimental design, like the one I just described. Some are RCTs that include a counterfactual that is a control group, and most of them are RCTs that include multiple treatment arms. Next. Okay, so now I'm going to briefly reflect on kind of some lessons learned over the last 5 years since we started this work. The first set of lessons here is coming out of an independent review. At the end of the pilot phase, so between 2019 and 2021, those 2 years were considered a pilot phase for the WFP impact evaluation strategy. That was really for 2 reasons. The first was because we were not sure what kind of demand or whether it'd be feasible in WFP, so it was kind of a way to learn what works. But it also aligned then with the new policy, which we knew was going to be published in 2022. So overall, the review found that there was positive feedback. Most of the country offices involved in impact evaluation saw benefit. There was struggles for sure. There was issues early on, but most of them were able to deliver an impact evaluation design that they were happy or saw value in, and were overall happy with the idea of doing more impact evaluations. And actually, one of the big complaints was there was more demand from country offices than what we were currently needing as WFP's Office of Evaluation. Next. The other thing that it recommended is we start to think a bit more about how we deliver impact evaluations. So it recommended having more capacity in the Office of Evaluation to support impact evaluations. Again, we didn't have a unit at this point. It was really just a very, very small team of a couple of people working in Rome. And so they recommended that there should be a more investment in in-house capacity to make sure that the process of engaging in impact evaluations is as smooth as possible. They also suggested having focusing more on capacity building and linking more with country offices and the global academic communities in countries where we work. They also pointed us towards broadening the methods we were using. Again, we were doing mostly RCTs, but we weren't at that point doing much more on top of the RCT work in terms of qualitative or other evidence. And they also said we should do more like events like we're doing now to improve awareness of the strategy and make sure that people are aware of the opportunities. And then finally, there was a recommendation to think about how do we institutionalize impact evaluation in WFP so that it just becomes business as usual when appropriate. Next. So we immediately responded to that. We just finalized impact evaluation in El Salvador, which is going to have its N-line workshop here in another month or so. And following the N-line data collection last year, we worked with a qualitative PI to do a qualitative study that looked at differences that were already visible in the N-line data from the quantitative work. And so what you see is, yes, we see improvements, which is positive impact in terms of quantitative measures on household consumption on the left-hand side. But on the right-hand side, you see one of the quotes that came from the qualitative work, which again had a qualitative sampling strategy that tried to unpack different experiences. And there it says that at the time my children got sick, I had to buy medicine, and they had the money that they needed to actually do that. So it's a really nice way to make a much richer picture over what would be normally just a little graph on the left. Next. The other thing we're doing is in countries where we have high frequency data, which is our resilience window, we've also developed high frequency data dashboards. And these allow country offices to see every time that we have new data from those high frequency surveys, which run every 2 months. They can actually, within a short period, see the changes over time in the different outcomes, but also in things like coping mechanisms, other things where we collect data. Next. And then finally, as mentioned, the humanitarian workstream is moving away from, I guess, traditional RCT methods and doing more what we call A/B testing. And that's really based on both the recognition that in an emergency setting, people need support. It's not really whether they need support, it's about when or how you get the support. And so here's an example of forecast-based financing where we have a little bit of money up front where we can actually support households before shocks happen, and then 2 versions of responses. Now you could say, oh, it's always great to do it early, but there are good arguments to question whether that's true, particularly in terms of like flood responses, where if the markets are completely destroyed, or there's a change in what you expect in terms of price or purchasing power from the transfer within a short period of time, there's good reasons to think about whether or not the timing is right for different households. And similarly, not every household will be affected the same. So there's also gains in understanding, again, who's most vulnerable or who needs the most support in reconstruction. Next. Okay, so that's me. I mean, that's everything I was going to say today. This QR code, if you get a chance, you can scan that. I don't know, maybe we could pull it up later again. And that'll allow you to join our mailing list, and then we can make sure that you get our future newsletters. Okay, over to you, Zlata.
Thank you very much, Jonas. I will, at the end of my presentation, I'll return to this slide and leave it for people to scan. So we'll move on to UNICEF. strategy and what we are doing. And WFP example is very inspiring, at least to us. And I often say that we are 3 years behind WFP in terms of developing this area, but we definitely are making our first steps. First step was also developing a strategy. We call it evaluation of impact strategy, reflecting the broader definition or the broader perspective on this area of work. We also have gone through a very long, extensive consultations through evaluation of function of UNICEF, but also externally. And now, hopefully, we are in the design and layout stage, and hopefully the document will be available very soon. But before I start and share with you some key pillars of this strategy, I just would like to echo the key messages, the key takeaways that were presented at the very beginning, to which I fully agree with, but also say that when designed and planned well, impact evaluation or high quality, rigorous impact evidence is a very powerful tool to make a difference. And it is not an assumption, it's actually a fact. And just to give you a very few examples, most recent examples, there are definitely more, of UNICEF evaluations that were commissioned very recently and already had some very positive influence on government decisions to scale up, but also programmatic changes and programmatic learning. So Mozambique social protection, the rigorous impact evaluation, which was conducted alongside the process evaluation, demonstrated very positive results on the cash plus model, cash transfer plus case management and social behavioral communication package. And this allowed or enabled the government to scale up the pilot phase, which reached around 15,000 children, to decision to reach 250,000 families with children within the next 2 years. India sanitation, national sanitation project, the evaluation of economic and financial impacts of the Swachh Bharat mission led to the sanitation cabinet decision of additional government funding of 18 billion to increase the programming within the next 4 years. Nigeria, I chose this example because of its actual influence on the programmatic changes and programmatic adjustments. Alongside the impact evaluation of the volunteer community mobilizers network on polio eradication, helped UNICEF country office to advocate for retention of 17,000 volunteer community mobilizers from polio eradication campaign, but also helped the country office to make adjustments and changes in the health strategy and social behavior communication programming. So there are, of course, institutional rationale for UNICEF to strengthen the work on outcomes and impact levels. First of all, the new strategic plan, 2022-2025, has for the first time, explicit focus on outcomes. And we have a mandate to support that as a change strategy. This relates to accountability. And another aspect of accountability is the pressure, increased pressure from donors and executive board to demonstrate effectiveness of UNICEF investments. Learning is critical, and as previously was said, learning probably is a very important and the core element of this work. UNICEF programs become more innovative, more integrated, and we have to test interventions that are being implemented, rolled out, simply to know what works and what doesn't, not to waste money and efforts. And secondly, our humanitarian programming is rapidly expanding. The investment in humanitarian programming also rising. So we need to find new innovative ways to show the results in that area. So our vision kind of outward looking and inward looking. So outward looking, we think that our better evidence, impact evidence will help and support national systems and policies by facilitating UNICEF advocacy and supporting national partners in their decisions to scale up child-focused policies and programs. And inward looking, it simply contributes to improved organizational effectiveness by through allocating limited public resources to the greatest need. I have to say that our approach is slightly different from WFP in that we recognize that our UNICEF, our areas of work are very broad, and UNICEF works upstream as well as downstream. The work on advocacy, governance, public finance for children, for instance, are as important to UNICEF as our intervention type of programming. So therefore, we say, and again, recognizing there are internal and external discourse in this area, we say that programmatic parameters define the purpose, evaluative purpose. And we need to look at what is the nature of intervention, what is the nature of outcome we are looking at, what is the nature of the program, what kind of questions we ask, are they causal questions or not? And then we see which track we take. If causal attribution to outcomes through credible counterfactual is possible and feasible, then we go for impact evaluations in which specific quantitative methods are best positioned to fit this requirement. If the program or interventions are more suited for causal contribution, then we need to apply theory-based non-experimental methods that are also available and also very credible for specific research and evaluation questions. So we also looked at did some diagnostics and where we are at the beginning of this journey. And UNICEF has done quite a few evaluations, and some of them are very well known, specifically thanks to their transfer project and social protection. But we identified overall that UNICEF commissioned or conducted 36 impact evaluation over their 5-year period. This is about 6% of the total number of evaluative products produced. We see a substantial thematic and geographic disparity, and this is one of the challenges. Social protection is very well covered, but other areas like ECD, nutrition, adolescent programming, and even child protection have very, very few credible, rigorous evidence available. In terms of the methods, UNICEF evaluations to date have been both including RCTs and experimental designs, but also a lot of our 21 were done using quasi-experimental approaches. So we identified a number of challenges also through online survey of our staff. I'm not going to read or elaborate on those. You're all very familiar with them, including high cost and resources and low awareness and capacity on the ground of staff and partners to understand the feasibility and parameters, requirements of impact evaluations. So based on that, we developed 3 strategic pillars. And I will just say a few words about each of them, what we are currently doing. The first pillar is to increase initiation, coverage, and requirements for impact evaluations across UNICEF. Again, as I said, UNICEF has been doing impact evaluations for a long time. But what is different now is that we are trying to develop, similar to WFP, a more strategic, more holistic approach to generating this evidence, identifying the areas of high priority within this current strategic plan, the areas with the least coverage, and trying to stimulate our demand and initiation in those thematic and geographic areas. So one way to do it is to explore, we don't call them thematic windows, but are basically, it is some priority areas. We would like to use the Impact Evaluation Catalyst Fund that will stimulate, basically provide matching contributions to country offices to initiate our impact evaluation, rigorous impact evaluation evidence. The first step is, again, slightly different approach from WFP. We start from a multi-country impact feasibility assessment. And we have completed one on child marriage just now, jointly with UNFPA. And we have started the one on mental health and psychosocial support. And I will say very briefly what it entails in terms of methodology. Second, we will start very soon a very comprehensive impact evaluation package for adaptive social protection in partnership with BMZ, which includes 4 impact evaluations in fragile context. Here, the interesting model is that it's a comprehensive evidence project. So it's not only impact evaluations, but it is operational research and data innovation. And finally, we work on supply side, and so we are trying to establish our partnerships with academic institutions and other actors, but also worked on long-term agreements with impact evaluations, which will be finalized, I hope, very soon. Just to give you a sense on multi-country impact feasibility assessment, which we consider as a systematic, expert-driven, and strategic approach to understand what is feasible, what are the opportunities and limitations to conduct impact evaluation portfolios. It basically consists of 4 steps, starting from stock taking on the literature, mapping interventions or identify global gaps against UNICEF interventions, then programmatic deep dive into our selected list of countries, and then final recommendations. Just the methodology includes developing a very specific and clear criteria for selecting country cases, including political interest or demand for rigorous evidence at the country level. At the end of the day, we want to scale up. We want this evidence to be used. Our operational facilities, meaning the existence or availability of strong data collection companies and national partners that could support us process, and so on. Pillar 2 focuses on diversification of methods and innovation. And this work very similar in the way that Jonas presented. We also will look at, we're already looking at their better utilization of secondary data sources, administrative data, household survey to utilize the quasi-experimental designs. Right now, we are focusing on humanitarian portfolio because this is where the evidence is really lacking, not only for UNICEF, but globally. But for that work, we really focus on outcomes. We recognize there are short and intermediate terms that usually applied for humanitarian setting. This is with a credit to our regional ICAR office, who initiated and launched the so-called digital RCTs, low-cost RCTs of digital services or digital applications, basically using big data. The results will be available at the end of June, and we hope to replicate these models for other regions. And generally, in terms of methods, we promote mixed approaches, but very close integration of process-related evaluation questions with impact evaluation questions, using so-called nested approaches that would help the program to receive short-term learning, respond to the short-term learning needs of the program implementers, but also contribute to their global learning and longer-term evidence needs. And the third pillar is basically capacity building and learning. Again, addressing some of the challenges of low awareness, a low understanding of among program staff and evaluation staff in the field. What are the requirements for doing rigorous and credible impact evaluations? But at the same time, we, as I said before, we do promote and we do try to support our regions and country offices with other methods, non-experimental methods, contribution analysis, qualitative impact protocol, process tracing. We are developing a methods guide series that will provide a user-friendly versions of those methodologies to support our summative evaluations that would want to look at the, would want to ask causal questions and look at the contribution. We are interested in developing national capacity impact evaluation, and some of the ideas is to develop a network of academic institutions of the South and young evaluator fellowships that would support and give opportunities for young evaluators and young researchers to work on impact evaluations. So our immediate priorities is institutionalization of impact evaluations and the new evaluation policy, revision of which is ongoing right now. Test the more cost-efficient methods, and I saw the question in Q&A about costing was probably the first question and very salient for this area of work. So A and B testing that Janas mentioned, this is what we are going to try to do as well. And we are planning this year, we are planning to launch this multi-country initiatives in specifically in adaptive social protection and child protection and nutrition. So this is all from us. Celeste, I don't see if Stefan joined the panel.
Stefan, no, I did not see him.
So we waited for a guest, as I said at the beginning, from GIZ to say a few words, but we can start addressing some of the questions. And maybe, Jonas, if you want to answer the question about costing.
I mean, it's, I don't know, well, it ranges by a very large amount in WFP. The cost of our impact evaluations are down to the country context, the number of survey rounds, and the timeline for the impact evaluation. So at the low end, we see impact evaluations that are, I guess, what we call more lean, so between $200,000 or $300,000. And again, those are often ones that harness the monitoring data, are more about the A/B testing designs, and are not going for many years. At the high end, it can go way above that if we're running surveys over 3 to 5 years, and and providing constant support. It can be multiple times that. So just to put it in context, that's actually not very high compared to a lot of WFP's centralized evaluations or decentralized evaluations. So you can do impact evaluations for about the same cost of any evaluation, but you can also spend a lot more if you have a reason to, and there's, I guess, important reasons to collect that data. Over.
Thank you. So I see Stefan joined. Just thank you. Hi, Stefan. I introduced you at the beginning, but I will say it again. Stefan Bier, social protection advisor at GIZ, our partner, and we have been working with Stefan in the last year quite intensely, developing the portfolio on impact evaluation for adaptive social protection. And so we hope Stefan will give his thoughts on from programmatic side on the potential for this area of work, evaluative work. Over to you, Stefan.
Thanks, Lata, and hi, everyone. Sorry, I was connected, but in spectator mode, so that's why you probably couldn't see me. So yeah, let me maybe say a few things about my current position, and then I can situate that in the way the kind of evidence that UNICEF is generating comes in very handy there, and how useful that kind of work is, and some other reflections related to that. I hope that sort of goes into the intended direction. Otherwise, feel free to steer me in a different direction. Yeah, so currently, the sector initiative or sector program means that I'm primarily tasked with advising BMZ's sector unit on social protection, which means we very often have to very rapidly react to all sorts of different social protection related questions that can sometimes be quite political, but also sometimes be very nitty-gritty operational questions when it comes to like just quickly responding to something that we hear from some operational programs that we're implementing or whatever. So therefore, in that work, it is absolutely vital that something like, for example, the transfer project has done over many years has been done, because without that, my job would be so much harder. So it's really invaluable, and I think very often for the policymakers, they don't see that side so much, because in a way we're the mediators between researchers, between evaluators on the one hand, and then the policymakers on the other hand. But for us in this intermediate position, that kind of like rigorous evidence that is also combined with operational insights, all the different kinds of evaluation approaches that the few minutes that I was there, Zlata also highlighted, bringing that together and clearly teasing out the gist and showing how solid it is and what we know for which context and all that, like having done that in such a comprehensive way for social protection, and that example of the transfer project is absolutely invaluable. So I'm very happy. And then leading now to what Zlata also has indicated, that now through the BMZ UNICEF partnership, it very much looks like there's going to be an ASP, so adaptive social protection related evaluation partnership, which my hope is very much that what has been achieved before for one area will now be done for another area, so that going forward, again, my work, which is currently focused a lot on adaptive social protection, will also become much, much easier, because we can stand on that firmly established knowledge, and we don't always have to go back to the drawing board, but we can basically stand on those established factors. So this is something that I personally feel is maybe underappreciated sometimes. So I just wanted to flag that to everyone who is working in evaluation and so on. And I've worked in that area beforehand, just to flag that. So I know that it sometimes can actually be a bit frustrating, and maybe sometimes one doesn't quite know how it then filters into something. But I just want to say it actually is incredibly valuable, even though you might sometimes not see it. And therefore, I'm very happy that to the extent that my current position allows it, I can still facilitate between those two worlds and sort of have at least one foot still in that area. So I'll leave it at that, but feel free if you had any discussions earlier where I wasn't there yet that I should get into.
Thank you, Stefan. I just will reflect saying that it's a very common argument that impact evaluation is very, evidence from impact evaluation is very contextualized. It's only applicable to one specific context and cannot be replicated or generalized. This is true unless the impact evaluation evidence is generated at scale. And the transfer project showed as an example that the scaled up of evidence, and then it becomes, we reach the saturation level. We basically know that, okay, this works in context A, in context B, in context C, then it means that it's likely to work in context F, right? So that's why the whole point of doing the strategic approach of planning and developing impact evaluation portfolios in specific thematic windows, priority thematic areas, is to build this evidence base that you are talking about, that allows us to replicate the most successful and most transformative interventions. But let's move. Thank you so much for your intervention, and let's move to the questions. Jonas, do you see there? Do you see the questions?
Hi, sorry. This is Malika from UNICEF. I think I can
Malika,
moderate
yes.
I can moderate some of the questions, considering we just have 5 minutes left. Yeah, so the first question is for Jonas. The audience members wanted to know how you integrate the different components, so lit review, qualitative and quantitative, to answer different puzzling results. And just related to that, if you could speak a little bit about the feasibility assessment to decide on the impact evaluations at WFP.
Yeah, sure. I mean, very much similar to what was presented by Zlata. We do see the literature review as a key starting point. I mean, when we do the literature review, we're looking at not only which interventions were effective, but also what were the outcome measures they used. So we do also look at the actual modules that were used in the data that's available. For the cash and gender, that include doing a meta-analysis actually of some 30 impact evaluations done prior to our window to understand, again, what is the average impact across many, many studies of a transfer, and does that vary by transfer size or by recipient? So it very much informs the pre-analysis plan for window. Now the windows keep going, but we do have multi-country pre-analysis plans, and so this design where we were varying the targeting towards women was informed by that literature, and then that design was registered. So we do register all our designs, and that one is the American Economic Association registration. In terms of the qualitative, this is something that we've been playing around with. I have in past lives as both academic and bureaucrat used the qualitative work to inform design. So I've personally been engaged in impact evaluations where ethnographic work was used to select interventions to be tested. In the cases so far, because we're really focusing on WFP interventions that are, again, high value and need to be tested, we've actually so far used the qualitative work to unpack different anomalies or subgroups that we see in the inline data. So for El Salvador, it was looking at participation rates, household characteristics, different things that would were not obviously answerable using the survey data that we had, and then sampling from those to understand those differences in more detail using the qualitative work. But we're very flexible. I mean, we're constantly learning while we do and thinking about how to integrate those two pieces. And then again, the intention is to always feed back into the literature. Over.
Thank you. The next questions are for Zlata. So how many of the UNICEF 36 impact evaluations were demanded by donors? And also if you could elaborate on our strategic pillar second with some practical examples.
It is difficult to say. For sure, the transfer project, which constitutes the bulk of our impact evaluations in there, are social protection window, so to say, was funded by donors. It was a partnership and still is between University of North Carolina, Chapel Hill, UNICEF, FAO. And my understanding, it was donor funded by DFID and other donors, CEDA including. Others, it's very difficult to say. Sometimes it is part of the bigger program proposal to the EU or to other country, and it's included already in the donor-funded project. So I would say probably a substantial amount of impact evaluations are part of the donor or funded by donors. In terms of the examples on Pillar 2, what examples?
I think they're curious to know if there are any practical examples for the mixed method strategic pillar 2.
Mixed methods, I think it's a general approach for us for all impact evaluations now to combine the quantitative and qualitative work. I think it would be very difficult not to find impact evaluation commissioned by UNICEF without any substantive qualitative components. So it's more or less a common practice. Mozambique example that I showed at the beginning was done in parallel with the process evaluation, but was pretty much integrated and information was triangulated between results of both evaluations. On the non-experimental methods, the methods guide that we are preparing will have our specific researched, and we found a number of specific examples, and they will be included into the methods guide that we will publish.
Thank you, Zlata, and thank you.
How are we doing in terms of time?
I think we are close to wrapping up. We just have a few seconds left, so you can take the floor.
Well, I want to thank everyone. The questions I'm scrolling are now the questions and answers. We will try to answer them after this session. Both Jonas and me. So bear with us, and really thank you for joining us today. And thank you very much. And do not hesitate to reach out and ask any follow-up questions. And some of them I will probably need to be directly followed up. Thank you very much, everyone. Jonas and Stefan particularly, and Malika and Celeste, thank you for the support. Thank you. Everyone have a great day.
Thank you all. Bye.